So now we will study about the drugs affecting uterine motility. Okay, drugs affecting uterine motility. There are two types of drugs that affect the uterine motility, that are ecbolics and tocolytics. Ecbolics and tocolytics. Okay, these are the two groups of drug which affect the uterine motility, ecbolics and tocolytics. Now we will first deal with ecbolics. What are ecbolics? Ecbolics are the drugs. Ecbolics are the drugs which stimulate uterine uterine contraction and helps to expel its content. Okay, ecbolics are the drugs which stimulate uterine contraction and helps in expel its content. Okay, ये वो ड्रग्स हैं जो यूट्राइन कॉन्ट्रैक्शन में हेल्प करते हैं और जितना भी कंटेंट होता है यूट्रस में उसको बाहर निकालने की कोशिश करते हैं. ठीक है ना. दीज आर द ecbolics and uses of this is used in full term or in case of abortion. Okay, abortion. Next, it is used in controlling postpartum hemorrhage. Next, it removes the retained placenta. Next, it clear the uterine discharge. It will clear the uterine discharge. Okay, it will clear the uterine discharge. These are the uses of ecbolics, and there will be one contraindication. This drug should not be used in case of dystocia. Okay, dystocia. This drug should not be used in case of dystocia. Now we will classify this drug. These drugs are classified in three groups. Okay, three groups. These are, first, posterior pituitary hormone. Second is ergot alkaloids, and third one is prostaglandin and analogs. Posterior pituitary hormone, ergot alkaloid, prostaglandin and analog. These are the three groups of ecbolics. Now we will deal with posterior pituitary hormone. What are the posterior pituitary hormone? These are oxytocin, carbotocin, and pituitary extract. Okay, pituitary extract. These are the three posterior pituitary hormone which are classified under ecbolics. Okay. Now, how to remember this drug? Just remember police, cops. We will tell it as cops. Just remember cop. Okay. C, carbotocin. O, oxytocin. P, pituitary extract. Okay. Next, ergot alkaloids. In this there is ergotamine and methyl ergotamine. Okay, methyl ergotamine and methyl ergotamine are the examples of ergot alkaloids. Now we will move to next is prostaglandins. Third one, PG and analog. Prostaglandins and analogs. In this, the examples are PGE2, PG2 alpha, and misoprostol. Okay, remember these three examples: PGE2, PG2 alpha, and misoprostol. These are the prostaglandin and analogs. Okay, this is all about ecbolics. I will not much more discuss about this oxytocin, role of oxytocin, carbotocin and pituitary extract. Just remember, oxytocin helps in increase force and frequency of uterine contraction, and pituitary extract will stimulate the contraction of estrogen sensitized myometrium. Okay, and about ergotamine also increase force and frequency of uterine contraction, and prostaglandins play important role in secretion of female hormones, that is in ovary and myometrium. They helps in regulation of estrous cycle. Okay, this is all about ecbolics, and I will briefly revise it. I will revise this. The drugs affecting uterine motility, there are two groups of drugs that affect the uterine motility, that are ecbolics and tocolytics. Ecbolics are the drugs which stimulate uterine contraction and helps in expels its content. It is used in full term or in case of abortion. It controls the postpartum hemorrhage. It removes the retained placenta. It clears the uterine discharge, and contraindication is this: it should not be used in case of dystocia. Okay, it should not be used in case of dystocia. Then this ecbolics are classified into three groups, that is posterior pituitary hormone, ergot alkaloids and PG analogs. Examples of posterior pituitary hormones are oxytocin, carbotocin and pituitary extract. Remember COP. Okay. Next, ergot alkaloid examples are ergotamine and methyl ergotamine. Next, PG analog. PG analogs are PGE2, PG2 alpha and misoprostol. That's all about ecbolics. Okay, ecbolics. In next class, we will deal with second group of drugs which are affecting uterine motility, that is tocolytics.